Welcome to all. Today talk about the topic is impedance Plethysmography. The impedance Plethysmography is a non-invasive technique that measures change in electrical resistance in the body to access the blood volume and blood flow. It can be used to evaluate the heart, lung and peripheral vascular system. The impedance Plethysmography principle is, in this technique the electrical impedance of any part of the body is measured by constant current method and variance of this the impedance are recorded as a function of the time. Here some electrodes here using the voltage and AC current. The voltage is measured the circuitry in voltage resistivity and the AC current is given to the current source in AC current. Then here placed the electrode in radial artery. Then here the block diagram here using the amplifier and rectifier. Amplifier is amplify the input signal and rectifier is converted to AC to DC. Here output is taken by the impedance output and admittance output. Impedance is the impedance directly given and the admittance is the reciprocal term of the impedance. Then uses of Plethysmograph: measuring heart rate, accessing peripheral arterial diseases, detecting deep vein thrombosis, measuring respiration rate, measuring water content of the lungs. Then here using the lungs in peripheral Plethysmography are commonly used to measure the functional resident capacity or FRC of the lungs. In the volume of the lungs, when the muscles of respiration relaxed, the total value of lungs capacity. The traditional Plethysmography test subject or patient in place inside a sealed chambers the size of a small telephone booth in which the single mouthpiece. At the end of the normal experience, the mouthpiece is closed. The patient is asked to make of inspiratory effect as the patient tried the inhale to the lungs expand, decreasing the pressure within the lungs and increasing lung volume. In turn, increasing the pressure within the box since the closed system and the volume of the box compared as disease accommodate to the new volume of the subject. Here using the limbs. The limbs device is attached to the arms, legs or extremely used to determine the circuitry capacity. The water Plethysmography is the extremely arm is closed. The water filled the chambers in the volume of changes can be detected. The air Plethysmography used to the similar principle of the air filled lung cuff. The more convenient of the issue accurate. Another practical device is mercury filled strain gauge and continuously measured the circumference of the mid-half. Plethysmography is non-invasive method used to detect the veins thrombosis of the area in the body. Then, how to prepare the Plethysmograph? There are no special requirements to prepare the limb Plethysmograph. Having the lung Plethysmograph should avoid the smoking, doing exercise and 8 hours before the test. Should always lightly because the heavy meals and cannot affect your ability of the breathe deeply. It can be risk and wear loose comfortable clothing. The test requires the sitting in the small space. So it can be hard and people who have fear and the small space. Let your doctor and you think may be problem if you is also important to tell the doctors taking the medicines. Okay. Thank you.